All right, why don't we go ahead and get started? We're at 10:04 and I want to make sure that we stick to our time today. So good morning, everyone, and welcome to the Rising Together series. This is a series of webinars that we've been doing really focused on services to youth and young adults who are experiencing homelessness. Today's session, we're going to focus on program design for work-based learning and for employment for young people, and we're gonna dig in on program design today. So, thank you for joining us, and welcome to the session. If you were on already, you can also see in the chat there's directions to rename yourself. So put your first name, your last initial, and the organization that you're representing. If you want to put your pronouns, we welcome you to do that as well. So we're going to go ahead and get started. Sarah, you want to, thanks, advance the slides. So, today, as I said, we're going to focus on program design, particularly around work-based learning and employment. So these are the things that we're going to accomplish. One, we really are going to focus in on understanding the key elements of and the framework for program design and using evidence-based practices. And so we'll talk lots about what do we mean by evidence-based practices today as well. We're going to learn about some programs that are serving youth and young adults experiencing homelessness, and some are local models. We're going to talk about continuous improvement in programming through outcomes analysis. And so sometimes when we talk about program design, it doesn't always mean starting from scratch. Continuous improvement and tweaking a model that you might already have in place to improve your outcomes is one of the lenses that we're going to look through today. And then we're going to have a chance to do some case studies and to do some pre-planning so everyone can roll up their sleeves together and get a little practice on some of the program design elements. And with this series, you will be able to find, after the series is done, all of the slide decks from the series of webinars that we've done, as well as the recordings from these sessions, and for each a tool that you'll be able to use to go back and work in your program. So that's where we're at. Sarah, you want to go ahead and advance to the next slide? So our agenda for today, we're going to do a morning opener. That's where we're headed next. We want to talk a little bit about the rationale and the context for program design, why being thoughtful about program design is really important. The elements of program design, what are the component parts that you need to have in order to do it, whether you are starting from scratch or doing a program strengthening or tweaking. The how-tos, we want to give some really clear guidance around how you can do this. And then we have an opportunity to look at a couple of case studies and for you to try out a couple of tools in thinking about program design and the framework. And then we will close with a few takeaways. Next slide. Okay, here's our morning opener. So if you could open up your chat box. I know I asked you all to be on mute, so if you're not talking, to keep it on mute, just so we can keep the outside noise from distracting us. But think for a second. We want to start, because today we're focused on program design. Start by thinking about what makes a program model successful for serving youth and young adults. You'll see YYA lots, and that's what we're talking about, youth and young adults experiencing homelessness. So if you could put in the chat, what are the elements that make a program design, a program model successful? And what's most important for meeting the needs of the youth and the young adults who are experiencing homelessness in those programs? So if you could enter that into the chat, we just want to capture your early thinking here, would be great. So I'll give you a second to do that.
We have a couple
just gonna lift those up.
Floating around with Devin and Teresa and Devin for the budget. To prep them on what we're presenting.
And if you could just a reminder to mute would be great. Unless you're speaking, there'll be plenty of opportunity. We really want to engage with you today. So what I'm seeing is continual incorporation of youth and young adult voices, really important. Resources that are actually working, systems and routines, communication, schedule flexibility, resources for both income and trainings.
Yep.
Resources and counseling, built-in layers, extra support, heightened communication and expectations, peer engagement, vocational supports, connections to health and mental health providers. I think we're hearing lots these days about the importance of mental health supports. Most of you have probably already seen, there have been several reports out there called the kids are not all right, and just the challenges of COVID and for young people around mental health. Open door policy for clients who need to leave and return to programming. I think we've all seen lots of young people, they need multiple opportunities to try out programming, and when life throws them a curveball, to step out and then step back in. Mindfulness of the feeling of those affected by homelessness and how it can be a barrier to achievement. Open and honest communication and listening. Engagement and positive communication. Organization, communication, thoughtfulness. So lots around communication, lots around flexibility, lots around including the voices of young people in program planning, which is great. Eliminating barriers to entry, systems, routines, and a fail-safe plan, mentorship, case management services, centralized services. Yeah, those are all really important in thinking about the program model, for sure. Okay. Any other last things that folks wanted to add in terms of thinking about what else a model should include? So communications, barrier elimination, case management, youth voice, flexibility, opportunities to step in and to step out is what I see here as well. Any other program components that are really important? Mentorship, I also saw. Okay, great. That's a really good starter list. Sarah, let's go on to the next slide. So let's talk a little bit about successful program models, and the design of the program is really, really important. So when you're thinking about your model, and again, I want to continually reinforce within this session, program design doesn't always mean starting from scratch. So when we're talking about program design today, it could mean you're looking at your model and you may decide, once you go through a process, and we'll talk about the steps and the processes, that you might need to do a complete redo of your design. But more often than not, programs are doing some tweaking and rethinking the services and the strategies to get better outcomes. So when you're thinking about doing this, you want to think about what the rationale is for engaging in program design and what is the context for design. So in thinking about why would you need to take a look at your program model, there has to be a rationale for doing that. Either you may decide you're not getting the outcomes that you're looking for. Maybe your young people are not engaging in the way that you expect them to engage. And then you want to look at what's going on in the world around your particular program when you're thinking about the design and what you want to offer to young people. Let's go on to the next slide. So 5 reasons to do program design. I started to talk about this a little bit. So one, there's a, if you're looking to do a design or a redesign, there's a need for the program. So, that young people are coming to you and you want to have a design that you explore that meets the needs of the participants of the program. You want to have a model that you're considering that's been shown to be effective. And so we're going to talk a lot today about evidence-based practice. Evidence-based practice, and we're going to look at the formal definition in a few minutes, but we're really talking about models where there have been studies and there are outcomes that prove the efficacy of a particular model. And so most funders these days are looking for evidence-based practice when they're choosing to fund program models. You want a design that can be adapted to fit the context. So if you are serving young people who might be on the older end of the age spectrum, you want to have a model that meets their needs. So if you're serving, 20 to 24-year-olds, what a 16-year-old might need might be different than what a 22-year-old might need. So you want to adapt your model or think about your model in terms of the context and also what's being offered currently in terms of the community. And you want to have a model that's working for youth and young adults who are experiencing homelessness. And I already saw in that initial chat, lots of folks incorporating youth voice and also making sure that that there's good communication, across the folks within the program as well, and communicating that to the program participants. So that's all really important. Next slide. So we've also been talking about the context. So thinking about the context of the programs, you want to be thinking about the populations and the situations where they might be living in. So if you're looking at program models, as you're starting to think about program design, and you're looking at evidence-based practice, you want to look for models that are going to meet the needs of your service population. So since we're talking about providers that are largely within the context of the city of Boston, is the model that you might be looking at, or your model that you're currently implementing, is it designed for an urban setting? Is it designed specifically and intended for young people who are experiencing homelessness? Does the design take into account young adults being served across multiple systems? We've done a couple of these sessions already, and in previous webinars, we talked a lot about young people getting their needs met across multiple providers. So sometimes, a young person who is unhoused may be working with a program that focuses really primarily around housing issues and supports and case management. And they may be coming to you or to another program for employment services. And so, they're working with multiple providers. And so does your model take into account the needs of young people who are being served across multiple systems? And we've talked in some previous sessions about case conferencing and partnership and working across service delivery systems to best meet the needs of young people so they don't fall through the cracks. Is the design part of a larger service delivery system? And so if you're thinking about the model that you are delivering, are you one piece of a larger system, and how do you function with partners, and how do you function in that larger system? Are you exploring a design that can be adapted? So you may be thinking about doing some tweaks to your program, or if you have found a model that you think is really strong and makes sense and it has evidence-based practice, but maybe it's geared toward a slightly different service population, can it be tweaked or changed to meet the needs of your service population, particularly youth and young adults? Maybe it's a model that was originally designed for adults. So are there changes that you can make that are going to best meet the needs of the youth and young adults that you're serving? And does the design consider the diversity of the population? So, if it's a design that was developed for a different population, is it going to work for the young people that you're serving? So, thinking about as you're exploring program design and thinking about either your current model or taking on a different model, these are all the things that you want to be thinking about as you're starting to explore what might be next for your program. Next slide. And then we want you to consider the challenges, right? So thinking about young people, particularly those who are being served across multiple systems, there's some key questions for consideration. So does the design take into consideration multiple systems? As I just said, young people could be served by providers who are focused around housing for young people, maybe coming to another program for employment services, and may be going to another program for education services. So they're being served across multiple systems. And those systems, in order to provide a really strong safety net and cohesive strategy for young people, those systems need to be talking to each other. So if you're thinking about a program design and a program model, you want to consider what are you able to provide and what are others providing for your service population, and how are you going to coordinate those services together? What systems do you need to put in place for communication? We saw that in the initial chat, right? So lots and lots of folks talking about communication and the need for really good communication. And this comes into play when you're thinking about your program model. And then the young people that you're serving who may be getting services and supports across multiple systems, that communication is really, really key. How are transportation needs taken into account? So, within the city, young people might be able to get from place to place. Can they do that safely? Is transportation an obstacle, either in terms of safety or resources in order to get from one program to another program? How about their technology needs? If you're doing programming and they need to have a laptop or or they have a smartphone, do they have a place to charge their phone? So what are their technology needs? How is your program design going to play into the technology needs of your service population? So another challenge to consider. What adjustments do you need to make for young people who might be parenting? Is childcare an issue or a challenge? And particularly during the time of COVID, where lots and lots of folks have struggled with childcare and the lack of childcare, thinking about what you need to do either within your program or in partnership with other programs to meet the needs of parenting young people. And thinking about other accommodations in the model for dealing with curveballs. So we know that young people, sometimes they might be cruising along at a good clip and doing really well, and then life throws them a curveball. How are you going to meet their needs when that curveball does come their way? I think folks also initially put in the chat. So having places for young people to enter in and exit out and come back into your program and into the system will be really, really important. Next slide. So when you're designing your program and you're thinking about what that looks like, planning should not happen in a vacuum. So I think, doing this in partnership and doing this with a lens toward looking at what else is happening out in the universe is really, really important. So conducting a needs assessment. You want to understand what are the needs of young people in the community, conducting research, what's out there currently, what services are being provided, what programs are currently operating, and looking at what is out there, what's available, what young people can currently access, and looking for where the gaps are. So doing a gap analysis. Looking for evidence-based practice models and gathering input from stakeholders. So again, doing a planning process before you even start to go into program design, to gather information, to gather some data, to do some research, to talk to other folks, other stakeholders in the community and other program providers before you go about either tweaking or redoing your program model is really, really important. All right. So in thinking about this, we have an opportunity here. We want to hear from all of you and think about if you're going to embark upon a planning and a design journey for your program, who are the stakeholders that you want to or need to involve in your planning? So who do you need to talk to? Who do you need to get input from as you're thinking about your current program model, or if you're thinking about changing your model and either adapting or adopting a whole new model? So if you could enter into the chat, who are the stakeholders that you should include as you're starting to embark upon a program design journey? What stakeholders do you need to be involved in this process? So take a second and enter those into the chat. So other providers who are experienced in serving serving housing unstable youth, community service providers who are working with a similar population, staff, youth, funders, and partner agencies. I think that's a really important list. Management or leadership, young people themselves, daycare staff, funders, organizational leadership, so program managers, directors, and budget folks. Yep, money is really important. I'm able to pull it off. Mentors, healthcare providers, including mental health and physical health, and folks who have a focus on substance use. Yes, 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 yes. Thank you for that, Lene. Young people themselves, management, mental health providers. So I'm seeing social workers, college campuses, landlords, Department of Education, youth, staff, and charitable organizations, employers, getting employers to the table, parents or caregivers. Great. Those are all really important stakeholders. So thinking about those stakeholders, I think, planning is an iterative process and assessment is part of that process. And the stakeholder input is going to be really, really key here. Planning doesn't always mean, though, that again, as I said, you're not necessarily starting from scratch, and you want to involve your stakeholders, but you might not necessarily have all stakeholders at every single part of your planning process, right? So one of the things you want to be thinking about is being strategic about which stakeholders you're involving and at which point in the process, right? So who you're going to pull in early on, who will be engaged the whole way through, and then there might be opportunities to get input from some stakeholders at strategic points along your planning process. Let's go on to the next slide, Sarah. All right, so key stakeholders. First thing is you want to identify them, right? So who is affected by the program? So and you've already identified that. So many of you already entered into the chat, the program participants themselves, the youth and the young adults, and other partner agencies who might be serving the same population. We think all the time about the young people who are involved across multiple systems and engaging them. Who are those providers? So you want to start to develop your list and figure out who you need to have at the table. Staff. So those who will need to implement the program design, either the tweaked program design or a new program design, and those who will use the findings, so the program planning staff as well. You want to prioritize. So as I said, not everybody needs to be involved in every single step of the planning process. So being strategic about who is involved and at which steps in the process. So how to use their time. So in many planning processes, folks have a steering committee. It's a subgroup of folks who will be involved from the very beginning all the way through the planning process. And I think oftentimes having a steering committee that has representation across your different stakeholders is really, really important. So it's an opportunity to have some youth voice. It's an opportunity to have staff input. It's an opportunity to have you could have employers, you can have other stakeholders, certainly management and leaders in your steering committee. And then along your journey is to pull in and get input from folks along the way. And so doing some interviews or some focus groups is another way to get input from some of those stakeholder groups without having them involved in every single solitary step, because that becomes cumbersome. Let's go on to the next. All right. So let's talk a little bit about the design principles themselves. So the needs assessment. Have you identified a need? What's available already? And what does the population need? What are the objectives and outcomes? So what will the program accomplish? So thinking about, what are you trying to get done by having a new or a reconfigured program design? Adaptations. What outcomes are needed, but you don't have in your current design? The principles. What are the principles or the rules and the values for your program? What are the program components? So what services are you offering, or what services do you think you need to offer in order to meet your outcomes? The budget and the cost and the funding strategy, so the resources to implement. And many of you already put into the chat to make sure that there are funders or folks from your budget department in the planning, because that's going to be really, really important. And what's the governance? What's the process for decision making in your design? And then once your program is designed, what is the governance and what's the decision making look like within your program model? So I'm going to pause there for a second and see, are there any questions so far in thinking about the design principles? So if you have a question, you can either unmute or enter it into the chat.
I don't have necessarily a question. I have more of an observation.
Yeah.
Definitely thought out in depth. It could feel a bit, I don't want to say overwhelming, but just feels like a lot of information. And not to say that I don't understand the information, but it just in looking at it from a bird's eye view, it feels like there's a lot, and it's just being proactive, I guess, is what you really have to be mindful of, and always looking at forecasting ahead, and not as they say, hoping for the best, but planning for what is to come. So I just want to make a statement that it's really well thought out, and it's just it invokes having to put the pedal to the metal and really getting to the meat of, in the core of what needs to be done, not for youth, but just in individuals across the board.
Yeah. So Aaron, are you thinking about, let me just ask you a little bit, to probe a little bit more here. Are
Yeah.
you, it feels like a lot. Are you thinking what feels like a lot? That the steps in thinking about the process to go through to design or to redesign or to tweak your program?
Yeah. Well, not, and maybe I'm using the wrong term. I don't feel that it's a lot, meaning that it can't be accomplished. There are a lot of steps that can be implemented, and it's
Yep.
good to be able to see it in that format, and not kind of be all over the place. That you have a clear and concise way of doing things, and it's good for me to see it in this way. And to be totally transparent, in the work that I'm doing here at Children's Services of Roxbury, we have a young adult youth population,
Mm-hmm.
and we have some internal practice
Yep.
for that young adult population, but it's not necessarily with our department. I'm in the housing and stabilization department.
Okay.
So I've always had um, a desire to better serve the young men and women that are in our specific program, and hopefully that thought and that initiative can be branched out and encased across the board with children's services. So it's just good for me to see visual the layout.
Yep. Yeah. Yeah, it's I completely understand and I hear you that this could be and can feel overwhelming, right? But I think we're going to walk through today the component parts, so hopefully by the end of today it doesn't feel quite as overwhelming. And if you think about it, with just as with anything, if you break out those pieces and follow the steps in through the design principles and the strategy, and you're checking off as you go along, I think you will end up, with a design that I think will make sense. And I think it is, it's not for the faint of heart, and it is a lot of work. Um, but I think thinking about each of these pieces in a sequence can be really, really helpful. And you don't. I feel a little bit like I keep saying over and over again, you don't have to start from scratch. You don't have to start from scratch. I mean, part of the whole rationale behind looking at evidence-based practices, there are programs that are already designed that are serving your population or similar populations. And there is, there is nothing wrong with taking a look at a program design that may already exist and saying, oh, there's a program in Seattle, Washington that's serving young people who are experiencing homelessness. And here's their program element, here are their program elements, and they're able to get these outcomes. And that design could make sense for our young people here in Boston. And then you go through a process to figure out, well, what are the changes or the tweaks that we might need to make? Can I wholly adopt that model? Can I take that model and use it for our own here in Boston? Or do I need to adapt it because maybe, as I said before, maybe it's designed for a population that's a little bit older or a little bit younger, and you might need to make some changes and accommodations. So, I think and you'll see as we're going through today, there are strategies here so you are not left to start from scratch and to figure this out, right? And so there's just really clear guidelines, and we're going to give you some tools, and we're going to walk through some tools to help with that process. So thank you for that. Jonathan, I saw that you entered into the chat. You're looking for recommendations for layers of decision making, and what are the types of decisions that are best suited for leadership level, and the types of decisions that should be dedicated to the client and service level. That is a really, really great question. There is a framework actually that that was developed by the Interaction Institute for Social Change, IISC, called Facilitative Leadership. And the framework for that really speaks to decision-making and how to involve folks at different levels of decision. So there, as you're going through a program design process, you'll be thinking about who needs to be, and the framework for the for facilitative leadership is based on what's called maximum appropriate involvement. So if you're thinking about sort of the bigger budget decisions and the funding strategy for your program design, that's not necessarily the kind of decision that you might have young people involved in, right? But you definitely want your budget folks and your leadership folks and your development folks involved in those kinds of decisions, the people who are going to be looking for money and helping to manage the budget. So you want to be thinking about who makes the most sense for the kinds of decisions that you're making, and that framework might be helpful for you in taking a look at that in terms of maximum. It's called maximum appropriate involvement. Any other questions before we move to the next piece? And we're going to look at the phases of program planning. But are there any other questions that were lingering?
I think April asked a question about if you had any suggestions about how to get stakeholders feeling a similar sense of time urgency as the program design team.
Yeah, that's a really good question. April, can you, if you could unmute, have you experienced this? Are you talking from experience that you've been trying to do some planning and you're either struggling with getting stakeholders to the table or getting them to focus on the urgency?
Yeah, so I think sometimes when I've pulled in like external stakeholders or even like stakeholders in like other departments, when I've been on a team where I've been a member of the programs team and I've been trying to get, for example, like the policy and the communications team also to be kind of moving this forward, it can sometimes be tricky. So I was wondering if you had kind of suggestions on how to really create that sense of like joint urgency across stakeholders.
Yeah. I think sometimes bringing in youth voice, quite frankly, can be the way to engage your stakeholders and have them, if they're hearing either directly from young people or you're able to bring in from a focus group that you do of young people, that could give them the sense of urgency that there's a real immediate need to be met, and we need to move more expeditiously around our program design to be able to meet the needs of young people that are really struggling, can be the way to do that. And I think if you are whoever is steering this planning within your organization, whether it's the steering committee or an individual, having a really clear timeline with the deliverables that are attached to it when you're beginning this process is the way to hold folks accountable. And so if you're bringing them back to the table and holding them to the timeline, if it's sort of amorphous and you don't have clear deadlines for some of the component parts in your planning, people will, it doesn't then create that sense of urgency, and they will take advantage of not having clear deadlines, and that could delay processes for sure. So being clear, having a timeline and a time frame, sometimes, yes, that may need to get amended slightly, but being clear with folks about what your urgency and time frame is, and incorporating youth voice so they understand and hear from young people, whether that's directly or indirectly, about their needs, is a way to put a little fire under folks' feet. Thank you for that. Any other questions, Anna? Any other questions that you can see that we?
Nope, I think you hit them all.
Okay, great. All right. So three phases in program planning. So there's pre-planning, there is planning and program design, and implementation and improvement. And we're going to talk today about all three component parts. and they're a little bit different. So there's work that needs to happen in the pre-planning phase. So before you get ready to roll up your sleeves, it's worth taking the time to get ready to plan. That's just as important as when you're doing the planning itself. And then when you are implementing, oftentimes when you've either tweaked your design or you're starting from scratch with a new design, folks will do a pilot model. So starting small to try out to see what works, and then to tweak a little bit further if you need to before you do a full implementation, and really being mindful to look at the outcomes as either in your pilot, and then certainly as you do full-scale implementation, you want to be making sure that your outcomes are matched with what you're intending to do within your program. So those are the 3 phases. Let's go into, we're going to look a little bit more deeply at the pre-planning. So in the pre-planning around program, you want to identify the potential need. Is there a need in either in your program or in the community in your current design that's not being met, right? So are there young people that you're not able to serve, and that might not be served by other programs as well? So what is the potential need for either a new program element or a new program design that's either in your program or in the community? And you want to do that by conducting a needs assessment, right? It's not just, oh, I think we might need. You can start with, I think we might need, but conducting a needs assessment to really suss out what the need is going to be a really, really important part. And we're going to go into detail about each of these. You want to research potential programs for filling that need. You know, are there existing programs or are there other models that could be implemented? And you want to select an evidence-based design. Selecting an evidence-based design is going to help you, frankly, in terms of funding as well, because more and more funders, whether they're public funders or private funders, are really looking for models that have been proven. That's not to say that it's cookie cutter, but they're looking for models that have some outcomes behind them, and they are then more willing to fund those models. So let's look at the, I'm going to go a little deeper around potential need. Are there unmet needs for the young people in your program? So think about in your current program and the young people that you're serving, do they have needs that are going unmet? What are those needs that are going unmet? And then is this an opportunity for new programming that will require additional resources? Now, you may identify a potential need, and it doesn't necessarily mean that it's going to lead you to redesigning your program. It may be that you need to meet that need for the participants in your program through partnership, right? So I think the distinction is you want to be thinking about, is there a need? What are those needs for the young people? And is this an opportunity for you to do new programming or to connect young people to other programs that might be able to meet that need already, that you get that need met for your young people through partnership? Okay. Conducting the needs assessment is the next piece of that. And so in the conducting the needs assessment, there's 4 component parts here. One is you want to look at your plan. So what are the services that you're currently providing? What else is available in the community? And where are there gaps in services? So again, the idea here is to not be duplicative. If there's already 5 programs that are providing transitional employment, and you're not providing that, it doesn't mean that you necessarily have to be providing that service. Again, that could be, you connect with other programs through partnership to meet the needs of young people. But is there a gap that doesn't exist is there a service that doesn't exist in the community and a gap for young people? And are you able to provide that? So be thinking not just about your program, but how does your program fit into the larger community and into the needs of young people, is the first step in your needs assessment. You want to collect and analyze information. Again, this is, you can start with your gut. What is your gut telling you? But you want to have data behind it. So you want to collect and analyze the information. So doing focus groups with young people, doing focus groups with other providers, looking at data. And then, interpreting that data once you've collected that data. So quantitative data. What is the total number of young people who are experiencing homelessness in the city? We've provided that data in some of the earlier sessions. What are their needs? What is the capacity of the programs that are serving this population across the city? What kinds of services are they providing? And is there still a gap? So let's say, for example, there are, and I'm just making up numbers off the top of my head right now for the sake of this conversation. There's, 1,000 young people between the ages of 17 and 24 who on any given day are experiencing homelessness. There are, 200 emergency housing beds, and there's only 500 slots within employment programs. So you can, if you were looking at that data, you can figure out that there's a need for more employment programming for this population, and certainly more of a housing need. So thinking about looking at the data and looking at the numbers to figure out what the needs are. Interpreting that data. So looking, are there patterns? So are there upticks? So maybe there's providers, summer jobs, numbers go up of young people who then have an opportunity to engage in employment programming, but the numbers drop off dramatically in the fall. What is the data telling you in terms of the needs of what's available out there for programming and what the needs are for young people, to start to wrap your head around your own programming and what you can provide, either flying solo or in partnership with other programs. And then you want to document those findings. So you want to gather all that data and put it together in a report so you can sit down and take a look at it with your stakeholders. So I'm going to pause there for a second. Take a deep breath. Any questions on needs assessments and what kinds of data you might want to look at? You can either unmute or put it into the chat. Okay. Let's go on to the next slide then, Sarah. So here we want to talk about, once you've done that data analysis, researching potential program models to meet the needs. So if you figure out through your data and you've done some analysis, there are unmet needs of your young people in the community, and starting to look at different program models that might be out there. We talked before about understanding the community context. Who's out there? Who's providing what? What does that look like? What is your service population? And then start looking at some existing program models. You want to avoid duplication. As I said, if there are already a couple of providers who are providing a particular model, if you're doing another one of that particular program design, is that really going to meet the needs of young people? You want to understand the complexity of the young people that you're serving, and what are the needs that aren't getting addressed, and look for program models or designs that could meet those needs. Identify the assets and the strengths of the young people, and think about that in the program design, right? We want to have an asset-based approach, not a deficit-based approach. So what models might be out there, and it might not be models that are in your backyard. So it's doing that research. So getting online, doing web searches to find program models that might have really good outcomes and could meet the needs of the young people that you're already serving. Next slide. All right. So now we're going to roll up our sleeves a little bit, and you're going to do some pre-planning of your own. So before you start crafting your program strategy or changing your model, you want to do pre-planning, right? So this is before. So you're starting by doing some research. You're looking at the data. So who are the young people that you're serving? What are the other program providers that are offering services to this population in the community? Where are there gaps in services? And you want to think about your particular program and what you have to offer. So what we're going to do now is we're going to break out into small groups. And Anna just put into the chat, there's a document that you're going to use to do some pre-planning. It's a pre-planning survey. And in your small group, you want to be thinking about your program. So when you go into the breakout group, introduce yourself, give a 1 or 2 sentence snapshot. If folks that you're in the group with don't already know your program, share what your program is and what services you're providing, and just do a quick go around. And then there's a survey tool that's in the chat that you can open up and look at the program components. And you want to add in your small group, think about those program components and think, is your program currently able to provide the services for those components? So one thing is, cultural competency and cultural humility and relationships with young people. Do you do that well currently? Are you a culturally responsive program? And if you, and then, so are you providing that service? Is that service really important? And do you need to also provide that service in partnership with other programs? And so you're going to use this tool to think about the pre-planning of your program. Are you providing it? Are you providing it alone? Is it stronger if you provide that service or that program component with another program? And it's an opportunity to be thinking about what you are doing as in your program and what you might do in partnership, and where you might figure out there are some gaps. And this is sort of in conjunction with the work that you would do to gather data. Do this pre-planning survey as those initial steps and thinking along the design framework. Okay, so we're going to have about 15 minutes in your group to do this. So before we enter into the breakout groups, I just want to stop and ask any questions.
Susan, I have a question.
Yes.
When you're referring to programs, do you mean internally or externally?
Your internal programs of your organization. Are you able, so as you're doing this pre-planning, you want to think about your organization, but you also want to think about each of the, so you'll see when you open up this tool, there's program components. What are you providing? And then if you're not providing that particular service, can you partner with another organization to provide that service? Or are the folks who are in your group also not providing that service, and there's a gap, and you're identifying that gap? Did that answer your question, Naja?
Yes, thank you. I just wanted to make sure, because right now I'm working with youth and young adults.
Yep.
And we partner with external organizations.
Yeah.
And we don't know what's going to be like next year is going to be the end of the funding and what's going to be next for us. So I just was kind of like, do you mean like going out or in? So, or both, we could think of it.
It's both. It's both. What are you providing? What are the other folks in your group providing? between the folks in your group and you? Are you able to meet the needs of young people, or do you need to pull other folks in?
Thank you.
I think I understand, and I was asking kind of the same question, Susan, so I'm getting it. So whoever's in the breakout room, we're all a group together. We are one group. Everybody talks about what attributes we have within our individual companies, and then it all merges together. Then we see if it matches both case studies or just one of the case studies.
This is not the case study. This is just a pre-planning tool, Aaron. So this is right. So the case studies are a little bit further down the road.
Oh, okay.
For now, we are at the beginning. If you think about, so we all have our planning hats on today, right? So what we're starting with, we're gathering some data. We're looking to, who are our stakeholders? Who do we want engaged in a planning process? We're gathering data to understand what are the needs of our young people? Are we meeting the needs of the young people? What does the data tell us? What's the total universe of young people? Who are the other providers that are out there? What's missing? What are the gaps in services? If we're serving young people experiencing homelessness and we're serving them really well, where are there holes in the service strategy, right? Where are they falling through the cracks, and how do we figure that out? Next, now what we're going to do is we're going to do this pre-planning survey. And the idea is to take a look at, I work for Children's Services of Roxbury, and here's the services that we're able to provide. I'm now in a group with these 3 other programs. What are they providing? Are they able to provide the services that I'm not providing? And if the answer is nobody in this group is providing subsidized employment, I'll just say, right? Well, how are we going to meet that need for young people? Do we go into the network of folks and look for other supports, or do we have a model where we have a gap and it's an opportunity to do some program design? So this is the pre-planning survey is really part of this initial assessment process. So before I think before programs jump in and say, yep, I'm starting from scratch, I'm going to redo my program. You want to gather data, you want to gather some information, you want to be thoughtful about the process that you're engaging in, because where you want to end up is you want to end up with a model that has a design that's focused on the young people that you're serving and what the outcomes are that you're intending for them to get. And so you want to make sure that those things match. So doing all this pre-work sets you up to do that. Okay. Everybody good? Any other questions before we launch into groups?
Just to clarify, Susan, because I think so there were 2 links in the chat. It's the link in the chat that says link to pre-planning survey. So I see some folks are on the case study survey. You shouldn't be on that.
Yeah.
We'll be doing that one later. If you could go to the chat and link on the and click on the link to the pre-planning survey template, that's the one that you'll be using for this breakout.
And when you link on that, the directions, there's 4 bullets at the top of that sheet that guides you step by step what you're doing in this group. So you're going to introduce yourself. You're going to say, I'm Erin Tavares and I work for Children's Services of Roxbury, and here's what we provide for young adults who are experiencing homelessness. You're going to go around in your group and introduce yourselves. You're going to look at those program components and you're going to decide, how important are those program components, first and foremost. If you think that they're essential, then you're going to say they're essential. And are you providing that component, or is it somebody else in the group providing that component? So it might be one of you, it might be all of you. And then if the answer is none of you, it's figuring out, okay, here we have a gap, and what are we going to do about that gap?
Susan, sorry, I have another question.
Yeah.
So you mentioned young adults, like the program that I work, it's basically for young adults for living on a state subsidized housing.
Uh-huh.
So you were mentioning about homelessness. So I understand that the topic is homelessness, but can we also, think of the other way, like for people that they are on a state subsidized housing or others like Section 8 programs or others that we could think of pre-planning for them? for a program, or it just the focus would be this only homeless population?
It can be for both, right? So, it's for people who, I think, and we've talked in some previous sessions, Naja, about young people who fall under the official definition of homeless. There are young people who are couch surfing, right? And who are, sort of precariously housed, or young people who could be in temporary housing. So it can be any of those things.
Okay, thank you. We do have a homeless, we do have a program, it's called Secure Jobs, which is for homeless population, but not particularly for young adults. We serve also young adults, 18 and above in that program.
Yeah. Yep. So here we're talking about a young adult population. So really up to age 24 is who you should be thinking about in terms of the age range. Okay. Any other questions about this activity? Okay, we're going to open up the breakout groups, and when we come back, we'll do a quick hearing from you, just a snapshot about how your group went. All right, Sarah, go ahead, and if you don't mind opening those up. All right, welcome back, everybody. So let's just do a quick check-in. How did that go? I was bouncing into some of the sessions, and I know Sarah was bouncing into some of the sessions. Was it helpful to be thinking about some of these component parts through that planning tool, the pre-planning survey? And you can just unmute and hop in, or if
I'll
you want
hop
to.
in.
Yeah, go ahead, Aaron.
Yeah, definitely. It was good to put it into practice. And that's kind of what I was talking about earlier on when I said there was a lot of steps to it, to this process. And that is the first step, is having the conversation, which then sparks the next step, so forth and so on. And it just, it kind of just rolls over into what it needs to be. And I thought it was very, very helpful. And it pointed out certain aspects too. So it was wonderful. I know Jonathan Macros is going to give a little bit more information, but it was a good.
Okay, great. Anybody else? Was the tool helpful? I mean, I know it's hard to do this and to jump into a group with folks that you don't know necessarily, and people that you might not have met with before, and then some of you might be in groups where you know each other and you're more familiar with programs. But just in terms of the tool itself, is it helpful? Do you see yourself using this kind of a tool in thinking about your program as you start to wrap your head around doing some planning?
I want to jump in. The group that I was in, I think the tool itself could be useful. We don't particularly or specifically work with youth, and I joined so that I could learn, because I wanted us to be open to working with a variety of populations. So I came basically to learn, but I felt like the tool itself was good. The group that I was in was very similar. So we basically tried to apply it to the population that we work with, which is basically adults.
Okay.
But it was still helpful for me.
Okay. That's helpful. And Lene, I mean, I think one of the things that we're talking about in this program planning is that, as we're figuring out, if you're looking at program models, you want to figure out, like, do I want to take on that model wholly? Do I want to adapt that model? And if it's a different population, you might need to adapt the model. So I think what you're lifting up is an important point that we're talking about here, right? When it comes to program planning. So that's really, really helpful. Thank you.
And also, yeah, I was in a group with Lene. Is that, am I pronouncing it right?
Yep, close enough. It's Lene, but that's close enough.
Okay, yes. And we both was attended the session just to get some information, because our client base is really not the youth, although the age, the demographic kind of supports it. So we were just there just gathering all the information, but I think it was up until this point, it was great information as far as just opening up and just being able to not take away the youth, but realizing when we're all coaches, I would imagine, so we're all gonna come into a case similar. So it's just really just having I'm here for the information, and if I'm able to do a program design, this will be an effective way that I would start the process going through the process of this info session.
Great. Thank you
Had
for
a-
that, Donald.
You're welcome.
I did
I
have a.
can,
Mhm.
go ahead, John.
Yeah, no, I was just gonna add that thinking about the group that I was in, definitely there are folks who are experts in having providing the employment support and training, and our program, we don't necessarily have that capacity to provide some of the training, but I think as I'm looking at this document, it helps just to recognize, okay, maybe building that capacity isn't what we need to do, but really something that came up was really knowing how to network with the other providers who are stronger in one area than the other. And so as I'm looking at that form and trying to think about who's responsible for what, it's definitely different. It should be different for each of us because like questions about expertise in job development and job placement, that's probably not something that we'd want to be experts in, but the Office of Workforce Development or ABCD may be very interested in having that capacity. So we would more look at that as it's important, but definitely for a partner to be able to have that expertise.
Yeah. Thank you for that, Jonathan. Yeah, I think that's part of the point of doing that is to be able to take a look and figure out, I think not all programs don't need to be all things to all people, right? And so I think you want to figure out what your niche is and what you can provide and how do you best meet the needs of your service population and what can you do through partnership, right? And then sometimes figuring out that there might be a gap or a gaping hole for a particular service population. And it could be an opportunity for your organization or your program to embark upon doing some more planning to meet a need and to reconfigure your program design. So I think, going through this process where you're gathering data and taking a look at what you're providing, what others are providing, can be really thoughtful in it. You may land not far from where you are, or you may do a radical transformation, or you may just end up with some program tweaks. So thank you all for engaging in this. I think that, from the groups that I hopped into, I think the conversations were rich. So that's good. So we're at a point where we're gonna take a break. So everybody has a chance to get some water or do a quick bio break or just do a stretch. We are at 11:35. We're going to take a 10-minute break, so don't log out. If you could just turn your camera off and mute, come back at 11:45, and we're going to continue. We're going to take a look at, we're going to talk much more in the second part of this about evidence-based practice. We're going to take a look at a program that's a local program and the process they went through to use an evidence-based model and adapted that for their program implementation. And then we're going to dig in a little bit deeper, and we're going to end today with some case studies. So turn your camera off, mute, and we'll see you back at 11:45. Right. Well, welcome back, everybody. We're at 11:45, and so we have a little more than an hour left. For this next part of our time together, we're going to continue talking about the program design process. We've focused on pre-planning so far, and now we're going to go into program planning. And so we're going to start with looking at evidence-based practice. And so we want to hear from you. When you hear the term evidence-based practice, and we've used that a bunch this morning already, what do you think of when you hear that term? If you could enter into the chat, what do you think of when you hear evidence-based practice? Research backed, yep. Anyone else? What do you think of when you hear evidence-based practice? What's been used as a benchmark for success? Some history. Don't reinvent the wheel, refer to plans that have worked with others. Yeah. Empirical research and data. Best practices. Secure funding sources. Okay. Experiences, observations within the program. Okay. Yeah, so, I think folks have been putting it, so things, research-based, and so Sarah, I'm going to have you flip to the next slide, narratives from participants. When we're talking about evidence-based practice, we're really talking about effective programs that are based on the results of ongoing monitoring and program reporting or rigorous evaluation. So evidence-based means programs that have some research backing behind them, some outcomes, and some results that show the activities that are provided in the program have made help to make gains for the program participants. And there's outcomes, there's results, and there's data as evidence to show that the program model is effective. Okay, so the research shows it, there's results that are behind it, and there's a connection between the activities in the program to produce expected results. So that's what an evidence-based practice means. Next slide. How do you find an evidence-based practice? So we've been saying a lot this morning. There's no reason to reinvent the wheel. So if you're looking at your program, you've done some focus groups, you've done some soul searching to think about your program, you've done the pre-planning survey, and you decide that you want to, you either need to or want to do a tweak of your program model. You want to look for evidence-based practice. So you don't have to reinvent the wheel. And there's a couple of places where you can start that search. There's a national clearinghouse, particularly if we're talking about serving young people who are experiencing homelessness. There's a national clearinghouse on homeless youth and families. And we just entered that into the chat, so you can look at that as a resource. And there's also a What Works clearinghouse where you can find evidence-based practice. So those are good starting points. You can use the regular Google search and look for evidence-based practice, but I think that there's lots of resources out there to start looking for evidence-based practice and look at the different models that are out there as you are continuing to get ready to do a full-scale planning. Okay, let's move to the next slide. So the formula for success. So you want to look at the effective program design, an effective program design with effective program implementation, and looking at the context. We started this morning by talking about the context, what's out there, what's happening in your community, what services are being provided. You're going to have an increased likelihood of positive results. And this is sort of the formula for if you're looking at the program of what you're going to provide. A good program design that is coming with evidence-based practice and using a model where it's already been proven effective. Effective implementation, making sure that it's enabled within the context. So you're not using a model that was developed for adults in rural communities for an urban youth population. You want to, make sure that the context fits with who you're trying to serve. You have a much greater likelihood of having positive results. Next slide. Okay, so we wanted, in talking about an evidence-based model, I thought we might take a look at a model that many of you might be familiar with, which is ROCA, which is a program that started in Chelsea and is now in other cities, both in Massachusetts and also in Baltimore. But they are a model that used evidence-based practice to design their program. So ROCA did not all of a sudden one day say, here is our program design, and we're just gonna, we're developing this model and we're gonna go about our business. They use the process, a similar process to what we're talking about here today, to come up with the model that they are currently implementing. So for those of you that might not be familiar, ROCA is a program that serves youth and young adults. The population that they focus on are young people who have been justice involved largely. They work to create safety and stability for young people. They teach life-saving skills and have a subsidized employment program model. And they focus on sort of practice, relapse, and repeat for their young people as their change mechanism and thinking about in their doing their direct service work. So I thought I just want to quickly walk through what they did over the course really of almost 20 years around their program design as food for thought as you're thinking about your own program. So in 2004, the folks at ROCA, they started looking at their own current program model and looking at other model designs. They engaged in a theory of change process. And in a second, we're going to talk a little bit about, well, what is theory of change? And the theory of change model begins, thinking about what services you're going to provide for, and base that, and the services should match with the outcomes that you're trying to achieve. So they started their first process in 2005. They came up with their theory of change. They implemented their pilot transitional employment program model, which was based on an evidence-based model for adults in New York City. So it's a program that still exists today called the Center for Employment Opportunities, CEO. It was a program that started in New York City, was focused on justice-based adults. So for folks who were coming out of jails and prisons in New York City, and it was a model to get them day labor. So they came out and automatically went into a transitional employment program, so they would have income immediately and they got paid daily. ROCA took a look at that model and decided that they were going to adapt that model to meet the needs of young people in Chelsea. So that was the first thing. So, many of you may hear ROCA is heralded often as a best practice program, but it was a program that was based on another program model and their evidence, right? So just food for thought. And as you're thinking about your own programs, and they're not in the vein of not reinventing the wheel, here we have a local program that did the very same thing and has good results. So in 2008, they did an evaluation, and that was through CRJ to take a look at their model. Then they did a next theory of change process. They originally did not start with as narrow a focus as they have on the target population that they're currently serving. So they went through another process, and they then replicated their model. They went to Springfield after they started in Chelsea. In 2011, they did a third theory of change process and further narrowed the population to exclusively serving justice-based folks. And then they continued to iterate on their model, and now they're doing, they developed a model curriculum around cognitive behavioral theory based off of cognitive behavioral therapy. So again, it's just, I put this out there as a local example of a program that gets heralded for its evidence-based model, which was based on another evidence-based model. So as we're talking about your programs and thinking about program design or tweaking, again, it's not reinventing the wheel. It's looking at what's already out there, what programs have existed that already have good evidence and proof of the model and proof of practice. So the outcomes in an evidence-based model and the research behind it are really, really critical to thinking about those, to implementing a new program model. And it's going to make your program really appealing if you're using evidence-based practice in terms of securing funding to move forward. Go ahead. We already had our break. So in thinking about your program design, so we've gone through the pre-planning and now we're moving into program design. And before you begin, we've talked about this a little bit already, making key decisions based on data, needs assessment, and other community resources, right? So we don't want to be duplicative. We don't, if you're thinking about doing some reconfiguring or tweaking in your programming, you want to look at what's already out there and not not reinvent the wheel, but also not duplicate what might already be in existence. There's 4 key things that you can do as you're thinking about the population that you're serving and the objectives, the context. And if you're doing your research and you're lifting up evidence-based practices, you can take a look at those models and you have 4 options. You can take a look at your current programming and say, we're really not meeting the needs of our service population. You could decide we're gonna discard our current model in favor of choosing another model. And when you do that, you can adopt a program model. So you might take a look at an evidence-based model and decide, this is the same population, it's the same, the context is the same, we really like this design, there's really good outcomes, we're going to wholeheartedly adopt a particular model. So I gave an example before, maybe there's a program in Seattle, Washington that you discover that you think is a really good design that could work really well in Boston, and you adopt that program model hook, line, and sinker. You could take a look at your existing model and say, we are getting some good outcomes, but there's a couple of areas where we could really further strengthen. And that might mean a refresh of your existing program model. And then the other option is to adapt a program model. So you may take a program model that you've discovered that is based on evidence-based practice. And, just as Roca did, they found this CEO model from New York City that was focused on serving an adult population, but they took that model and they adapted it and made changes to be able to serve youth and young adults, right? So you can either adopt it wholly, like you found a model for the same population, the context is the same, we're gonna take it on hook, line, and sinker, or we're gonna adapt the model. And the same thing with a program refresh. You are taking the component parts of an evidence-based practice, and you may need to make some changes based on your service population. So those are your options as you're thinking about your existing program and what you're going to do to either going to refresh, start from scratch, or you're going to adopt or adapt. Okay. Next slide. I just walked through these component parts. So if, again, you really, in looking at whether or not you need to adopt or adapt your program, the most important thing is you want to look at your outcomes. Are you getting the outcomes that you're intending to get in your service delivery? So if you are a program and you say that, your focus is on having young people, let's say you're a workforce development program and your goal is to get young people into unsubsidized employment. Looking at your data, are you getting those outcomes? Are the outcomes that you're intending is what the results that you have? And if the answer is no, that would then ask those further questions and you're doing then your due diligence and figuring out, I need to do something different in order to get the outcomes that I'm trying to get for the young people that we're serving. And that would mean either adopting a new model or adapting a model and making some changes in your program. But the difference between adopting and adapting, again, is adopting is the objectives are the same. We're trying to do the same thing as an evidence-based model you may have found. The service population is the same, youth to youth or young adult to young adult. The context is similar, the resources are similar. And if that's not the case, then you may have found an evidence-based model that you think makes good sense, but there might be some things that are different. You could adapt it, just as Roku did with CEO. So the objectives are the same, but the service population might not be exactly the same. And the context now might not be exactly the same, or the resources. So you need to figure out what are the changes that you're going to make within that model to meet the needs of the service population, and what resources do you need in order to implement that particular model. Okay. All right. So we're going to move into thinking about theory of change. If you think that we just looked at the ROCA model, and I talked about, they went through 3 theory of change processes. So if you think about, Sarah, can you go back to the previous slide, just theory of change, there, the poll, whoops. Oh, did he? There we go. Does your program have a theory of change? And does your program currently have a logic model to drive the programming activities and outcomes? So theory of change, meaning you're thinking about what are your goals for the program and the activities that you're providing and what you're hoping to get to. So have you thought through as a program a theory of change? Do we have the poll set up?
Yeah, you want me to go ahead and launch that? Oh,
yeah, that would be great. So
you
could enter in to the poll. Does your program have a theory of change? I'll give folks a minute, and then you can answer the second question too. And then, do you have a logic model? And we're going to talk more in depth about those, but we just want to see first, top of the trees, what do you have? So we'll give folks just another second or two to go ahead and enter those in. So it looks like in terms of a theory of change, a lot of folks not sure if your program has a theory of change. And, but it does look like about almost half folks are saying that your program has a logic model to drive the programming, which logic models, we did a session a couple weeks ago around logic models. I don't know if any of you participated in that, but we're going to talk in a minute about, a little bit more about logic models. But the idea is to craft activities for your program participants, and those activities should be driving toward outcomes. So we're going to talk about those in a minute. So thank you for that. So that's helpful for us to really know and understand that if you're not sure if you have a theory of change, That's sort of telling. So let's go into, if you can close the poll, and let's talk a little bit about theory of change. So theory of change is, if you look at this visual, theory of change is what we would call the missing middle. So what's in between a program does, so the activities that are provided and the interventions and the outcomes that you're trying to achieve. So if you look at this visual, right, what do we see happening here? We see folks building a bridge, right? And so the goal would be, it looks like the goal is to get across this body of water, right? And so the activity is building the bridge to get over the body of water, but it looks, the bridge ends sort of mid-air and doesn't get you over the body of water, right? And so in the bubble said, maybe we should build a boat instead. So, the theory of change is, when you're thinking about this, it's what are the activities that you are providing, and what are the outcomes you're trying to achieve? If the activities you're providing don't lead up to the outcomes that you're trying to achieve, there's something amiss in your theory of change. And if you don't know or understand what your theory of change is, there's a chance that you might not programmatically be thinking about the activities and the connection to the outcomes. Okay. Does that make sense to folks?
Susan, can you give an example?
Yeah. So the example on this slide. So the outcome here is to get across the body of water, right? So that's the outcome we're trying to achieve. So the theory of change is, what are the activities that we should be doing and engaged in order to get over the body of water? Here, the folks are building a bridge to get over the body of water, but they've run out of the materials to get over the body of water, right? And so those activities aren't going to get to those outcomes. The same thing, if you are trying to, let's say in your program, you want folks to end up with full-time permanent employment, and you are and you are providing activities, let's say you're doing you have chess in the afternoon. Like, that's the activity that you're providing. It's sort of a silly example, right? But what are the activities that you're providing? If the activities that you're providing aren't getting you the outcomes that you're trying to achieve, you got to change what those activities are in order to get to those outcomes, right? So in this cartoon example, if you're trying to get over the body of water and you run out of materials building the bridge, you're not going to get to the other side. So how are you going to change those activities to meet that outcome? It's the same thing in program design. Does that make sense?
Yes.
Okay. Let's take a look at the outcomes framework. So if you look at in this one, so the outcomes framework is, what are the activities that are going to, this is part of the theory of change process. What are the activities that are going to lead to your outcomes? How are you going to measure those outcomes? And how will you evaluate the program's success? So if you look at the little cartoon here, you have some formulas on the left-hand side on that on the blackboard, and you have formulas on the right-hand side, and clearly, and then in the middle, the guy says, then a miracle occurs, right? So it's not getting from point A to point B, a miracle isn't going to occur. So the outcomes, if you're thinking about the outcomes you're trying to achieve, your activities need to be planned so that you're getting to your outcomes, and you should be measuring all along to make sure that you're achieving those outcomes. And if you're not, then what needs to happen?
So assuring that when you're not inadvertently missing key points or key factors to get the individual or individuals to that next stage.
Yeah. Or you need to, exactly. So you need to, if you're not getting the outcomes, you need to make some changes, right? So this is where the program design comes in. So either the activities that you're providing are not leading you to your outcomes, or you might have outcomes that might need, your goals might need to be changed or shifted as well. But if you have a set of outcomes that you've all agreed upon in your program, and you still want to get those outcomes, but the activities that you're currently providing don't lead you to those, you need to look at the activities, right? Because the activities are not getting you to those outcomes. If your goal is to get full-time permanent employment for your program participants, but you're providing after-school chess classes for young people, it's not going to get you to that outcome, right? So you need to be thinking about the activities that you're providing and change those in order to meet those outcomes. So you would want to do work readiness and pre-employment programming for folks, right? Maybe do subsidized employment so people are practicing their employment, their employability skills, doing skills training that will connect folks into the kinds of jobs that they might be looking for. So you want to be thinking about your outcomes and doing planning along the way. And if the activities that you're providing are not leading you to your outcomes, that's an opportunity for you to make some changes and tweaks to your program model that are going to lead you to more effective outcomes. But you won't know that unless you're evaluating and really taking a look at the outcomes and what you're actually achieving.
Susan, what do you suggest in terms of time frame for evaluation of a program? If we are successful, or we need modification or adaptation or adopting different ways to bring changes?
Mm-hmm. You should be, so I think it depends sort of where you are, Nadja. So if you, if you are a program that's been around for a long period of time, you should be looking at your outcomes regularly. So at least annually, at minimum, you should be looking at your outcomes annually. So if you set a target for meeting certain employment outcomes, let's say each year, and every year you fall short of those outcomes, that's the opportunity then to engage in this program planning and program design, and to be able to better meet your outcomes. If you are implementing a newer program, or you recently made some changes in your program and you're doing a pilot, you still want to be checking to see, are you getting the outcomes that you thought you would get, even in a pilot? Because there's an opportunity before you go from a pilot phase into a full implementation. You want to make some changes or tweaks to make sure that you're on target with what you're hoping to achieve in your program. So it will depend on where you are in your program, but you should be looking at your measures and your outcomes really frequently and consistently. And it doesn't mean that you need to do a full-scale third party, having an external third party evaluator every single year. But even internally, you should be looking at your outcomes regularly to measure to see if you're being successful. Are we meeting the needs of our young people? Are we getting the outcomes that we hope to get? And if the answer is no, then it's an opportunity to really do some looking at your theory of change, your logic model, your outcomes framework, and to be doing some reconfiguring of your activities and your program design to be able to better meet the needs of your program participants and get the outcomes you're trying to get. Any other thoughts or questions? Okay. Let's go on to the next slide if we could. So in program design, we've been talking a little bit about developing a theory of change as the foundation for your model. What are you hoping to achieve? Like what are you proposing as your theory of change as the foundation? And then creating a logic model to guide that work and design activities for your program with outputs and outcomes that are going to get you to those outcomes that and the theory and the underpinning of the theory of change that you're hoping for. On to the next slide. So logic model. Are folks familiar with logic models? If you put in the chat or just raise your hand, yay or nay. Have you folks familiar with what a logic model is? A little bit. Okay, so logic model, it's a visual way to plan a program, and it can serve as the foundation for planning and evaluation, right? So it's really a picture of why and how you believe a program will work. Okay, let's take a look at the framework. The next slide, please. So the last session in this series for the Rising Together, we did a session on logic models. That was recorded. All of these, just so you know, all of these webinars are going to be loaded onto the OWD website. So you'll be able to get those materials by downloading those and there was a whole session just on logic models. So a logic model, you start with the goal, like what are we trying to achieve here? And then you want to be thinking about a couple of big buckets in terms of doing your program planning. So resources. What resources do you have to meet the goal that you have outlined? The activities, what are you going to do? Like what activities are you going to provide? What services are you going to offer? How are you going to engage your program participants? What are you hoping to accomplish? What are so those are the outputs. What are you hoping to accomplish? And then lastly, what are the outcomes and the impact? So what are the short, medium, and long-term results of your program by looking at the resources that you're putting in, the activities that you're engaging folks in, and the activities that you are putting out there, what you're trying to accomplish, to look at your sort of short-term, medium-term, and long-term results. And so that's why, the continual process improvement and taking a look at where you are in your program is really, really important, and thinking about the logic model. Okay, let's go on to the next. So program improvement versus program design, we've been talking about this all morning, is, really not starting from scratch, but you also want to be thinking about those component parts. So some folks said, more than 50% of you said you didn't have, or you weren't sure if your program had a theory of change. And similarly around having a logic model, and those are the foundation. It's your roadmap for your program. And if you don't have this mapped out of what your activities are and what you're trying to achieve, and then what your goals are for outcomes, then it's hard to know if you're hitting the mark if you don't have that laid out there, right? And so it could be maybe you have pieces of that, but you want to be checking to see, it's an opportunity if you don't have a logic model, if you don't have a theory of change, I would strongly suggest that going through this planning process to put those things into place. Let's go on to the next. And so we'll talk a little bit about the right one. Okay, sorry. About program assessment. So assessment and looking at evaluation, and as I said before, it doesn't necessarily need to be a formal third-party evaluation, although those are important to do too. But you want to be able to at least look internally to determine if what you're providing in terms of activities to your program participants are leading you to the outcomes that you're looking for. So we're going to stay together in the full group, but in thinking about the ROCA model that I threw out there before, and the process that they went through, they did 3 different theory of change processes to adapt their model, and they did have external evaluations. So let's just think about that as a model for a second. And what I would love for you to do, so I just want to go through a couple of questions that are questions that you can be asking for your own program. We're going to use, talk a little bit about ROCA because it's a model that we talked about before. And so we have that as a sort of a common thread. So unmute and let's just have some conversation about this. If you think about the ROCA program model, and thinking about continuous improvement in your own program, but for the ROCA model, what do you think the risk and protective factors are and assets for the ROCA model that they target? So thinking about the young people that they're serving, what do you think that they're thinking about? What assets? We talked a little bit before about asset-based programming and thinking about the positive things that young people are bringing. Anybody want to just unmute and chime in? What are the assets that young people, so they're focused now on a justice-based population, and in terms of the services that they're providing, what assets might they be thinking about in terms of their program design?
I would say program engagement.
Okay, yep.
That they're
Go ahead.
that their young adults have like big goals and like a big drive to try and get like that goal accomplished.
Uh-huh. What risk factors might young people be bringing?
Like street activities that doesn't mesh with the program, being in sort of like a gang or just, you know, that's the risk factor that they could bring to the program.
I think another risk that they could bring is the immaturity of not quite thinking things through before they do them, or
Yeah.
just in their reactions.
Yeah, I would definitely second that, because I was thinking through this limited experience, right? Like, for the limited experience they have, there's a huge role in the decisions that they make.
Yeah. Okay.
Past traumas.
Past traumas, yeah. Yeah.
Also broken home, like, you know, even just the culture itself, they may pose a risk because of some of the things that happens at home, sometimes gets displaced outside, and it shows that the way the home is, if you get what I'm saying.
Yeah.
And to build off of that, they might not have the strongest like network
Supports.
around them. Yeah.
Yeah. Okay. So, so you're lifting up some of the challenges, right, that the program participants are bringing with them as they come into the program for services. What do you think in terms of meeting the needs of the service population and going through their theory of change, what do you think, what kinds of things might they be thinking about? If you, they, you know, in terms of their model, they talk about sort of, they talk about theory of change, and folks might relapse and then leave the program and come back into the program. So they have sort of this, the cycle of change for young people, right? And you all, when we started our session today, many of you lifted that up as well, as having, is thinking about opportunities for the program participants to come into a program, and life might throw them a curveball, and then either they need to stop out, or maybe they get you know, stopped out of a particular program activity, but then can come back in, right? And so if you think about that in terms of theory of change and program dosage, that might need to get configured into your theory of change, right? Which is the service population, and folks might need multiple opportunities to practice and to work through some of the challenges that they have until they get it right, right? So it is sort of this, it's not necessarily a straight and narrow path for everyone. So they start at point A, they don't automatically get, it might be they go to A to B to C to D to E to F, but then they might go from F back to C and then go to D, right? And so there's more fluidity in terms of how they move through the program components, and configuring that in to your model is a really important point.
I think, Susan, I can comment here.
Yeah.
We exactly experienced the same thing as you explained in our program, dealing with young adults. And exactly at the beginning when we started the program called the Launch program, we were experiencing that people, they will come and like, we would see a great number of people will leave the program, disengage for a long time, and then they will come back, and then they will leave. So it was one of the things that we were trying to make sure that we stay connected and engage them back, bringing that back to the program. And then we'll give them some space to, you know, to think around it, what we offer them and how they can take advantage of it. With these type of programs and population, long-term goals are very important, and long-term programs. We call it goal-based program, and goal-based program is much more longer the outcome-based program for us. And we think of a further, like, what is your short-term goal, medium goal, and then we go to the longer goal. And what can we do, and what type of communication and what type of coaching we can provide to keep them engaged. So, and then we went for dosages, like what are our active caseload and what can we do with this, and what are the disengaged, what are the people that they are already placed, and what type of support we can give and services we could give it to them. So we think of a 6 months to 3 years or 2.5 years of program when we designed this, the program, and then we went for the second phase of it also. So we did a lot of, you know, talk and conversation around the second phase, that this phase should be a little bit longer, because we want to, you know, people are leaving, going, coming and leaving, coming and leaving. And some people, they stay stable, some people, they are not. In terms of services, we noticed that a lot of people are going through mental wellness challenges. So that was one thing that at the first phase of the program we realized, and the change that it overall came, we got a component of partnering with a mental wellness agency, that you know, provider, that we could bring them at the end of the first phase and move to the second phase to give support this population. The modification was very huge. And then we went through a lot of surveys and a lot of, you know, reevaluation, connecting with clients and this population to learn about their needs. And then their needs became a part of another component to this program.
Okay, that's helpful. That's helpful. Thank you for that. Deandra, you have your hand up?
I did. It's perfect segue to and forgive me if I mispronounced your name. Naja was saying, because I was thinking in general for a lot of our programming, we tend to focus and plan around the deficits, although it's important to be mindful of them. But I think we also have to recognize that a lot of young people come with untapped talents and skills. And so in general, when I do like a lot of program design and planning, I try to like really focus on like what are their potential. So whether that's like checking in with them, figuring out what works, what don't work to design programs, that's like really valid. So even when designing surveys, like I make it clear that like, hey, like what you put in the survey is really important because it's really going to inform our practices and so forth. So I think that like part of it because like we in general program design, we need to be thinking about focusing on the asset approaches and whether it's like goal centered, that's a big one. Really important. And then taking into consideration participant voice.
So you're breaking up a little bit there, Deandra. And I, you know, several folks have said it's a little hard to hear, but I think what I heard you say is that you're looking holistically at the program participants and right? Okay, great. Thank you. I see the thumbs up. That's great. So focusing on the assets and strengths for sure, but looking holistically at their set of needs, I think is really important. Yeah, thank you for that. All right. So we are running a little bit behind, so we're gonna breeze through. We were gonna talk a little bit more about the other component parts of planning and looking at assessment for thinking about your program design. We're going to move through that and we're going to really talk about as you're implementing programs, you have an opportunity to be assessing them all along the way. So you don't want to wait until you've implemented your program and then 5 years down the road, you realize you're not meeting your outcomes and you decide to do something about it. You don't want to go that long of a period of time. And if you've made some changes, you want to be self-reflective and take a look at what you've done so far. And are those changes, are you starting to see some immediate shifts in terms of program outcomes, you know, even short-term outcomes. So we're gonna move into the last piece of our time together today. And again, the slide deck with the rest of the information and the tools will be uploaded into the OWD website. So you'll be able to still get all that information. So don't worry about that. We have a couple of case studies that we want you to focus on right now, and it's, as you know, it's an opportunity for you to do some troubleshooting around the program elements for when you're implementing your program. So this is a chance to really look within and take a look as you're implementing your program, to not wait until you're far down the road just to see if what you're doing is working, and to make some changes or tweaks along the way. So there are 2 case studies. We're going to ask that your group chooses one of the 2 case studies because we won't have time for each group to do both. To dig deep in on a couple of program components. So when you're implementing programming, you know, you're providing a whole array of services. The first case study, you're gonna focus in on recruitment and skill gain and retention within a program. And then the second case study, you're gonna focus on employer engagement and partnership and data. Okay, so when you go into your group, you're gonna choose which of those you want to focus on. You're going to take a look at there's a scenario and it's in the chat, so you can go ahead and open it up. You want to read that short case study. as a group. And then you want to think about what are the strengths of the design of this particular program model, and ask what questions you might still have as a group. And you'll see there's a block at the bottom of that case study to ask some questions. What else do you need to know about the particular model to determine if the model is strong? So the first case study, what else do you need to know about recruitment or skill gain or retention or after the program is over? And in the second case study, the same thing. What are the strengths of that model? And then you want to think about what else do you need to know? And in the second one, it's around employer engagement, partnership, and data. And what do you need to know? What else should be happening for the program participants after the programming? So you're going to come together as a group. You're going to choose which case study, and look at the strengths of the model and articulate what are the strengths of this particular model, and then what other lingering questions do you have about this particular model. It's practicing what we've been talking about today in terms of the program design. It's a chance to be reflective around a couple of different program elements and to come together as a group to do that. So you're going to have about 13 minutes to do this, and then we'll come back together. We'll do just a quick popcorn share out, and then we have a survey to close us out for today, and then we will be done. All righty. So we're going to go ahead and open up the breakout groups. Any questions before we do that?
Susan, just a quick reminder that groups 1, 2, and 3, we assigned case study A, and groups 4, 5, and 7 are going to do group B.
Okay, so
case study B.
And they'll be able to see what group number they're assigned to, right?
Yeah. I've titled the groups. Yep.
Okay, great. All right, we're all back. How was that how were the case studies? Was it a helpful tool in thinking about program components in terms of the conversation? You can unmute and just chime in.
Again, yes, this case study that we talked about, it was very, very helpful. Just looking at, we had some participants, but only a few, another person kind of, so it was kind of, I didn't get the full amount of information there. So it's kind of like only a 2-part information that I received. So it was helpful in that sense, but I would like a little bit more participation, because I think that, other people had information or something, because I'm here just to soak up information. I just, would like to prepare if wanted more participation. That's about all.
Yeah.
Right. I agree.
Okay. That's helpful. Other folks, was this tool helpful?
I think, yes, we were with the part of the case study B, and we were looking at different components of the program that they had for their participants, and big questions were around employer engagement and what were like the roles of different entities, agency, BCD, or their employer or their partner, what they were doing. So big question came in, and also about data that were not very clear, and they didn't collect enough information so you could tell what is the issue, and like you could not measure exactly what was. So different things of a program, I think a program design or a program implementation were missing there, and also not clarity on certain aspects of work relationship with different partners and what they were doing. So we came up with certain question in mind that what exactly going on, and how to keep in mind as we are moving and partnering, and the roles and responsibilities, and how to proceed. And the major thing was that what was the goal for those individuals when they would finish that training, CNA training program?
Yeah.
And what is the long-term goal for them? Would they end up with career, with jobs?
Right.
And who's going to give them the jobs? If there would be, who's going to give them the job? Because the ultimate goal is to people become self-sufficient and get a job out of those training programs.
Mm-hmm. Mm-hmm.
Yeah, for City B, it felt like their activities were not matching their theory of change of like getting people long-term into this like career path.
Yeah. That's a really important point, right? So I think it sounds like this is exactly what we were hoping to, looking at examples and looking at the activities that were being offered and asking some critical questions. Are those activities leading to the outcomes that you're really intending to have? I mean, that's the whole point behind either program design or program redesign or tweaking. Are you getting your participants to where you're hoping to get them to? And if the answer is you're not, then what changes are you going to make in order to have that happen, right? Great. So thank you all for participating in that. Thank you all for participating today. We are coming close to time, so I want to be respectful of everyone's time. We would love to hear from you, and so we have a survey we are hoping you will fill out to let us know, what worked today and what might have been even better. So in the chat, Anna's going to put in the chat the link to the survey. If you could fill that out, that would be great. Again, we are going to post these slide decks, and the recording of today's session will go onto the OWD website, so you'll be able to access the materials along with some other resources. So you can find that there. And there's one more session in this Rising Together series. So the week of June 6th is motivational interviewing is the next topic. And if you have not registered, there are 2 groups for that. If you haven't registered and you're interested, you should go ahead and do that. But I wanted to say thank you so much. You were a really terrific, engaged group, and I really appreciate your time and all your thinking into today's session. So please fill out the survey, register for the motivational interviewing the week of June 6th, and be well. Thank you all.